every time Christmas coming, oh Lord, man, I'm running and cleaning. But sometimes I just get distracted. Cause you see when I turn on the radio and I hear a Christmas song, oh, all my cleaning is interrupted. I'm tearing my feelings. I'm tearing my Christmas feelings. I'm whining more than I'm cleaning. I'm tearing my feelings. I'm tearing my Christmas feelings. I'm dancing more than I'm cleaning. Cause you got me in my feelings. I'm tearing my Christmas feelings. Oh, and you got me in my feelings. Because I know Christmas coming. Yes, you got me in my feelings. I'm tearing my Christmas feelings. Cause you got me in my feelings. Because I know Christmas coming. No, not yet. It's coming. It's coming. It's coming. Christmas coming. It's coming. It's coming. It's coming. I said Christmas coming. It's coming. It's coming. It's coming. Can you feel it coming? It's coming. It's coming. It's coming. My family say that I'm clean and slow, but they don't even want to know how the Christmas spirit got me excited. Cause once I'm in the mood, it's trouble time. No more cleaning on my mind. Feel like my soul has been ignited. I'm tearing my feelings. I'm tearing my Christmas feelings. I want it more than I'm cleaning. Yo, I'm in my feelings. I'm tearing my Christmas feelings. I'm dancing more than I'm cleaning. Cause you got me in my feelings. I'm tearing my feelings.
Who say health cannot have vibes? Well, Jolly's Pharmacy is proving you otherwise. With Health Vibes, every Wednesday morning on Q95 from 10 a.m. to 11:30. Health Vibes, education, information, and a bit of humor. And not forgetting lots of vibes. Hosted by Carlton Lango, with co-hosts Jacinta Fagan Defoe and Trudy Kristen. Jolly's Pharmacy is bringing health and vibes together every Wednesday, so be sure to tune in. Health Vibes every Wednesday on Q95 from 10 a.m. to 11:30. Jolly's Pharmacy, leading the way in healthcare.
A very pleasant good morning to you, my listeners of Q95, and welcome to yet another edition of Health Vibes from Jolly's Pharmacy. There is a lot of anxiety in the air for various reasons. But before we get to that, I just want to say good morning to all the staff of Jolly's Pharmacy, my family, to everyone out there that has visited, probably on their way back home. You know, we did enjoy your company and we welcome you soon enough. This morning, we have my co host, Trudy Christian, who is joining us virtually this morning. Good morning to you.
Good morning, Jacinta, and
How are
good
you doing?
morning. I'm good, and good morning, of course, to all our listeners on Health Vibes. So it is a different type of morning.
Yes, it is.
I am in my office. You are in the studio, but we're still, we're still together on this Wednesday morning in a virtual way. Jacinta, I know this week you mentioned the anxiety, of course, but I know this week for you is a big week. It's your birthday week.
Yes, it is on Friday. And I'm actually sharing birthday celebrations with Mrs. Fatima Jolly. So both of us have the
Ah,
same birthday. So I'm sure
okay.
she's also looking forward to it on Friday as well. So we are twin birthdays.
Twin birthdays, yeah. So, I
Yes.
mean, I want to use this opportunity to express happy birthday greetings to you, even in advance. I know
Thank you.
people like you and me who really enjoy birthdays. We celebrate for
Yes.
an entire week or maybe even an entire month. So,
Thank you very much.
yeah, so an early happy birthday to you, and I hope this week turns out well, despite all the things happening here in Dominica. I also want to say good morning to our, as I call him, the chief host, Mr.
Yes,
Carlton
definitely.
Lando.
I hope he's getting some rest.
Yes, much needed rest. Carlton, good morning to you. And of course, hopefully you'll be back with us on Health Vibes next week.
Yep,
So good morning to you.
of course.
And Yes, Jacinta. So, and I will share on air one of the reasons that I was not able to come into the studio this morning is the situation with gas. I have been trying to conserve my a very modest amount of gas because I am not joining those lines. So, hopefully this situation is resolved today. But in the effort to not stall on the road, I decided to stay put this morning and join you from my office. So it's
What
been something else.
it has been, I mean, thank God for technology. I'm able to see
I
you. I'm able to hear
Yeah,
you. You're still able to join
yes,
us. And we are
yes.
thankful for that. And I mean, going to work for the past couple of days in the long lines under the cliff, I thought I would never see the end of the line,
I
and
know.
it's something else. But amidst from that, I've been hearing some Christmas songs already. So there was an automatic switch from independence to Christmas. I'm sure people are looking forward to putting up their Christmas curtains and soaking their fruits for the Christmas cake, and
Yes.
so it's like a different switch, and of
Mm-hmm.
course the obvious anxiety levels based on the news of the upcoming elections and so forth. But it's health vibes, and we want to
Mm-hmm.
preserve our health as much as possible. So with all
Mm-hmm.
the anxiety, let's not raise our blood pressure levels and our blood sugar levels because of disharmony or discontentment or disagreements among us in whatever
Mm-hmm.
way.
Mm-hmm.
Let's try to do it in a very discreet and respectable manner if you are to have any discussions. But our lovely guest, well, she's not even a guest. I think she's part of our
I'm part of
Of
the
the Health
team.
Vibes team.
that's
Yes.
so good morning to you, Dr. Lisa Jolie, and
Good,
welcome again.
good morning, Jacinta. Good morning, Trudy. Nice to
Good
see you
morning. Good
virtually.
morning.
To show you to see me.
Yes, I can see you
Yeah. Oh,
guys. Good
great.
morning.
Yes. So I am glad to be here again. About 2 weeks ago, I teased that I would be back here talking about diabetes because November the 14th is recognized as World Diabetes Day, and many countries actually are you use the month of November as Diabetes Awareness Month. And we
Mm,
know this is one of the non-communicable diseases that affects a significant proportion of our population, that's responsible for a lot of morbidity, meaning people in the hospital and mortality, people who
Mhm.
die, not just here in Dominica, across the Caribbean and the world. And so we take the month and or the day to really highlight the plight of folks who are living with diabetes. This year, there's a very good theme, which is diabetes educate for tomorrow. And it's a very timely topic. It's one that's very important in terms of diabetes and diabetes management. It's something that I have been doing since 2018 in terms of providing education on this show about diabetes. It's something that I do in my office every day. And so I'm happy to be here to continue to educate the public or the Dominican public about diabetes, the reasons for the risk factors for diabetes, how it's diagnosed, and how it's managed. And so, if you know someone who has diabetes, who is taking insulin or who's taking tablets, somebody who may be at risk of diabetes, somebody who told you that their blood sugar was 200 the last time they checked it, I suggest that you call them and you tell them to to log on to Q95 to hear this show. And then we will
yes.
give you the numbers as far as if you want to call in for questions. But I really
Yes.
want to use it as an opportunity to educate. There's some new information, even and it's something that I keep really up to date on, and it's actually a field that is growing. And so I am glad that we have a day that recognizes it, and that I can just talk about the work that I do, really and truly.
Mhm.
Yeah.
Dr. Jolly, you mentioned, people should tell other people to log on and tune in. And I just want to echo that. And normally I would have started off by saying, tell a friend to tell a friend. This topic in particular, very, very important. And, in the same way that we might, circulate the latest BEF, this is something that we should definitely allow other people to tune into to get the much needed information. I know a lot of people may also be confused about some of the circumstances surrounding diabetes. It is a very prevalent condition, but at the same time there is still a lot of information that people do not necessarily have. So this is the opportune time to tell somebody else, share the news, tell somebody else to tune into this program this morning right here on Q95.
Well, we're going to take a short break, and when we come back, we will get right into the discussion. And of course, Dr. Jolly just mentioned that she has some new information. So she will go through briefly what is diabetes, the different types, and we're going to give the numbers very early in the program when we return, so you can call in.
Who say health cannot have vibes? Well, Jolly's Pharmacy is proving you otherwise. With Health Vibes, every Wednesday morning on Q95 from 10 a.m. to 11:30. Health Vibes, education, information, and a bit of humor, and not forgetting lots of vibes. Hosted by Carlton Langdo, with co-hosts Jacinta Fagan Defo and Trudy Kristen. Jolly's Pharmacy is bringing health and vibes together every Wednesday, so be sure to tune in. Health Vibes every Wednesday on Q95 from 10 a.m. to 11:30. Jolly's Pharmacy, leading the way in healthcare.
Welcome back. Welcome back. If you're now tuning in, you are on the Nation Station, Q95, and you are listening to Health Vibes from Jolly's Pharmacy. We have Trudy Christian virtually with us, and we have Dr. Lisa Jolly in studio with me. And the focus for today is on diabetes. World Diabetes Day is celebrated on the 14th of November. And from last year to 2023, the theme remains the same, where it's advocating for the education of diabetes and how can we protect the future with this means of education. So I'm going to give the numbers very early in the show so that whoever is listening, if you have any questions on diabetes, we have Dr. Lisa Jolly, who is specialized in diabetes. So 449-3095, 449-3096, 449-3097, 616-4257. If you want to make a contribution or ask from abroad, the number is 305-432-9624. So we welcome your contribution and your questions. So Dr. Lisa Jolly, for someone who has no idea what diabetes is, what exactly is it?
Oh, so diabetes is a condition. The manifestation is the elevated blood sugars, or that what we typically see in terms of the high blood sugars, but it is a metabolic disorder. So it's a lot more complex than simply the blood sugar that we use to diagnose. There's lots of reasons why somebody might develop diabetes and what causes diabetes. But the manifestation, meaning what we see either in the clinic or in the hospital, is the high blood sugar. The underlying reason comes down to this organ that sits really deep in our stomach called the pancreas. So if there is something that affects the pancreas in one way, or its ability to put out insulin, which is one of the main hormones involved in diabetes, then that results in high blood sugars. So if the pancreas is damaged, or it is removed, you automatically develop diabetes. So anybody, if they have a surgery to remove the pancreas for any reason, that's where say whether it's a cyst or it's a cancer, automatically, because the person can no longer produce insulin, they will develop diabetes. There's lots of different types of diabetes. The most common one we see is type 2 diabetes, which is related to diet and lifestyle. And that's because of obesity and physical inactivity causing the person to gain weight, causing insulin resistance. The pancreas is not able to put out insulin to keep up with that demand. And so it manifests as the elevated blood sugars.
Okay, so before you continue,
Yes.
I was reading something and they said 1 in every 10 people suffer with diabetes. This is a very worrisome status.
It is a very worrisome statistic. I look particularly at Dominica, and in Dominica, uh, from the last set of information or the data that we have, which goes back unfortunately to 2016, 8.6% of males have diabetes and 14.2% of females have diabetes. So on average, it's about 11.4%. I think that's an underestimation of the prevalence of diabetes in Dominica, because that would likely have only come from diabetes seen in the public healthcare system, in the healthcare centers and in the hospital. But if we have to look at Dominica in general, I think the percentage would be a lot higher. The other thing as well is that the diabetes we count is what we see. So if you think of there's a classic description, which is the iceberg, which is this huge piece of ice that we see above the water. But what we don't see what is going on below. So there are people who are walking around with diabetes, blood sugars in 200s and 300s, who remain undiagnosed. And so there's a lot more diabetes than we think. So we need better data in order to estimate that. And yes, and the other thing too is that the prevalence is increasing, meaning that we're seeing more diabetes, but also diabetes is affecting younger age groups. So we're seeing diabetes creeps down into people in the 20s, and we're seeing in the Caribbean and in Dominica, we're seeing people between the age of 10 and 20 who are developing type 2 diabetes, which we would classically see perhaps in folks in the 40s, 50s, but because of the changes in the lifestyle and the diet, we're seeing it creep down to teenagers, really.
I wanted to just interject here and ask a question as it relates to the prevalence that we see in Dominica and in the Caribbean, as you mentioned, Dr. Jolly. Yes, the lifestyle choices, but is there any other factor that we can maybe be looking at as to why we see such a high prevalence in our region? What is there any other contributing factor to that prevalence here?
I think one of the things is genetics, and it ties into diet and lifestyle. It comes back to diet and lifestyle as well, because I'll explain a little further that your genes are not your destiny. I think because of the region we live in, and again, a lot of our decisions concerning food might be based on cost rather than on nutritious quality. Again, we would be considered a developing country. And so you have to sometimes do a lot with a little. And so where you have a large population of people of lower socioeconomic status, where they might not be able to afford, where we have issues in terms of our education system, low education level. So all those, what is known as the social determinants of health, which account for actually 70% of our health, makes us very vulnerable to these chronic health conditions, non-communicable diseases. So at the end of the day, those factors do play a role, and genetics. If you have a mother and a father who has diabetes, then you're more likely to develop diabetes. And if you're not given the education or the tools early on in order to prevent that, then diabetes becomes your destiny. But I just want to say that your genes, though, your genes or the genetics or the history is not your destiny. There are many families in which you have 5 or 6 siblings who have diabetes, and there's one sibling who does not have diabetes. And the reason is that that sibling has taken note of the the lifestyle that their family engaged in. They look more closely at their diet. They change their diet from what their parents used to eat or what their siblings used to eat to something different. And their parents might have come home from work and sat down watching some TV in the evening, but they decided, know what, I'm gonna do a good 30 to 60 minutes of exercise every day, and they were able to change their destiny. And so it's just know that your genes are not your destiny.
All right, but it is important to know your family history,
Yes.
because the reason why this individual would have been able to take front
Yes.
and to be the only one
Mhm.
who is fighting off
The disease, yes.
is because he or she knew
They're empowered. They're
Right,
empowered.
exactly.
Of note, there's some where the entire family has diabetes, and that may they have just accepted that that is their fate, and they have continued in the same lifestyle. But if you notice that there is something in the family, then and you change your lifestyle, you can make significant improvements. I believe there's
So
a
with that-
caller.
Good morning, caller.
Yes, good morning. How y'all ladies doing?
No, we're doing well, thank you. How are you?
Good morning.
Oh, I'm good. I'm good. Interesting subject. I've heard this subject before on your show, and it's a subject that is widely known in the black community here in the United States, England, wherever that black people are. And it all goes back to I think Nurse Jolly or the Dr. Jolly mentioned your education level and all these other things, and your genetics really is not your destiny. But I want to mention Dr. Hilary Beckles put a piece out on the diseases like the things that we suffer from, hypertension and diabetes, directly connected to one of the things she mentioned, your level of education, and then our enslavement. And also, for my part, as far as I've known and seen and studied what little bit I have, the industrialization of food, packaged food, the refining of food that takes away the best part of the food and give you the byproduct, and it's treated to entice your taste buds, where you will deny the right stuff to eat and take that industrialized food. I also listened to a professor at UW, University of the West Indies, UWI, on Mona campus. And that was about 10 years ago, 12 years ago. That was long before Professor Beckles put his feet out. She spoke of a pending problem in the Caribbean for African descent people. Most likely that we are gonna be out of our what you call all our gross products, like not gross product, but our economic output is gonna be affected by treating hypertension and diabetes. And for small developing nations, we will not be able to build a nation like we should, because we will not be as healthy as we should. These two problems are gonna face. We're gonna face every time we turn around, because the cost is gonna take to heal the people and treat the people. They won't be able to move forward in the region economically. So I'm listening to what y'all are speaking of, and it comes down to what Miss Dr. Dolly said. Education is important. Dr. Beckles also mentioned that our DNA has been altered because of the enslavement of our people and the kind of food that they impose on us. And over time, it has affected us so much that you take an African in Africa and you give them hypertension medicine and some Europeans, and the medicine works for them. But Africans in the Caribbean, it don't work because of the alteration of your DNA. But it's a very interesting subject, and I'm listening to hear where this thing goes because it's a pending problem, and we are heading somewhere that we cannot move forward economically and build a healthy nation if we have these big problems with diabetes and hypertension. Ladies, thanks for having this talk this morning. Thank you.
Thank you.
Thank you very much. And you
I,
know,
I will say though he did make a good point in
Mhm.
regards to the consumption of industrialized, we call it industrialized food, or there's also a name called ultra processed foods or processed foods. And there is a significant increase in consumption of those processed foods, which are the ready to eat food. So if you eat a lot of foods where you just open up the pack or you just open up the can and it's ready to eat, that's a processed food, which back in the days they did not exist. We did not consume as many processed foods. We are consuming more and more processed foods and less foods that are fresh.
Yes.
And so that's something that we have to think about. And again, it goes as far as in terms of policy making, because we sometimes we have more availability of the processed and ultra processed foods that are sometimes cheaper, and it's more difficult to get the less processed foods that are better. And so recently they have been speaking about in terms of ensuring food security for Dominica and for the rest of the Caribbean. But the other thing we have to address, apart from just food security, is ensuring there is an absence of food deserts. And food deserts are areas in which either you can't have access to fresh food, because we might be food secure in Dominica, but if the food is not adequately, if it's not equally accessible to people across the country, then that spurs on the issues in terms of chronic health conditions. Because sometimes I have patients who are coming from, let's say, Tebow or Dailies or whatnot, who sometimes struggle to get fresh fruits and vegetables. And so we have to ensure that those healthy foods are available, accessible, affordable across the island.
Most definitely.
I know we've gone now into the discussion on food and that route, but there's something from previous mention by Dr. Jolly that I wanted to kind of go back to, and it was
Let's talk
about
about it.
yes, it was about people walking around with
Mhm.
very high blood glucose, undiagnosed diabetes.
Yes.
And I wanted to kind of go back to what are these signs and symptoms that people maybe, I mean, we hear a lot about what are the signs of diabetes, but maybe
Mhm.
what are the things that people are unaware of, little things that maybe could have given them an indication of this disease, or given them an indication to approach a medical
A doctor.
practitioner, yes, for treatment, for diagnosis. What are we overlooking in large parts as it relates to diabetes diagnosis?
So there's some symptoms to diabetes, but I want to remind our listeners that diabetes might not have any symptoms. And so one of the things that we have to have, I believe, is that we have to have some sort of national screening program, because there's so many people who have diabetes in Dominica. Really and truly, we should just walk around and check everybody's blood sugar ever so often, or whenever they encounter the healthcare system. That should be done as part of screening for diabetes. Education, like you said, is a big part, because again, some people are experiencing the symptoms or are seeing the signs and they don't know. And so if they know, they're able to come forward and say, hey, this is what I think may be going on. The most common one are the 3 Ps: polyuria, polydipsia, and polyphagia. The 3 Ps, big words. Polyuria, meaning that you're urinating a lot. I typically ask, how many times are you getting up at night to pass urine? Because people remember how many times they got up at night, because then it disturbed their sleep. And if you're getting up more than 3 times at night, that's concerning. So that's polyuria. Because you're passing so much urine, you also are very thirsty. So people will say, oh, they're drinking a lot of water. The other reason I know, when they come into my office, the one bottle of drink that they have a bottle of water in their hand, and they need to go to the bathroom before they see me and after they see me. So that's the clear symptom that their blood sugars are high. And the other thing too is that they find they're consuming a lot. So they're eating a lot of food, sometimes craving for sweet treats or sweet drinks in particular. And those are usually that happens more at the extreme. But there are lots of other things. If you're having abscesses, recurrent abscesses, particularly in the armpits or in strange places, that could be a symptom of diabetes. Women over the age of 40 who develop a yeast infection should be checked for diabetes. So the abscesses, recurrent urinary tract infections, infections in the urine might be a symptom. But if you don't have all the symptoms, but you have risk factors, meaning that you should be screened, that could be because of our ancestry, being brown and black people, we need to be screened. That's a given. If you have a sedentary lifestyle, so if you have an office job where you're sitting all day, it's a good idea to get screened. If you have your mother, your father has diabetes, if you have a sibling who develops diabetes, you should consider getting tested for diabetes as well. If you have any of the other chronic health conditions, such as high blood pressure, high cholesterol, any other conditions associated with insulin resistance. So these affect women. Polycystic ovarian syndrome. A large proportion of these women develop diabetes much earlier in life. And if there's that darkening, we call it acanthosis nigricans at the back of the neck, that could be a sign of insulin resistance. If you have a history of diabetes in pregnancy, which we call gestational diabetes, then you should be screened within 6 months after the delivery of the baby and every 2 to 3 years thereafter. And if you have been given a diagnosis, you've been told that you have pre-diabetes or you're on your way to develop diabetes, you need to keep on checking, because if you have not made the necessary changes in your diet and lifestyle, chances are within a couple of years, you will develop diabetes. And so, really and truly, I think we're at the point in Dominica where really and truly everybody should get the opportunity to be screened for diabetes, which is relatively easy to do.
Right.
Is there, to follow up, Dr. Jolly, is there an age, where that is optimal? Because I know one thing I will mention, a lot of young people
Yes.
will avoid screening because
Yes.
they figure they are too young. So, when you talk about just canvas screening, are all age groups
Eligible for screening? I think
Yes.
once, if as a general rule, perhaps if once the recommended age is actually 45, but we are seeing folks much younger than that who are developing diabetes. Women are usually screened usually in the second trimester of their pregnancy. So women, if they've been pregnant, would have been screened in 20s, 30s. But once you're 30, I think you should. If you have an annual visit to doctor, you go to see at least once a year. It's good to do a check. Hey, just go stick your finger. If you're passing down the road and one of the nurses are outside of Whitchurch and you say, hey, just prick my finger, check my sugar, check my blood pressure, you should never tell. You'd be surprised.
And that's important to note, because like you said, before, many years ago, you would see diabetes in older folks. And I think that's one of the reasons truly why you would see that many young people wouldn't see the need to screen for diabetes or hypertension, just because they feel they're energetic, they feel well, they're young, they have a long life ahead of them, and they would not have, well, many of them will not see any symptoms or signs of this condition. And again, this is where education comes in. So as we're doing this morning, reiterating the fact that you may not have any symptoms of the condition.
You may not have any symptoms, but still go ahead, just prick your finger, get to check, what your blood sugar is. Even if you don't have diabetes, you might have pre-diabetes, and that might be a great time to then it might really wake you up, hopefully, to make the necessary lifestyle changes to prevent diabetes. We have a lot of folks here, parents who have diabetes. And so if your parents have diabetes, then you should just treat yourself like you have diabetes too. And but also you should, as part of your routine health visits, you should, speak about that. And likewise, the doctors should, we should screen as well too. And it's a fairly easy test, which involves checking the blood sugar. At least that can give some indication as to whether the person has diabetes.
Right, and at Jolly's Pharmacy, at all of our branches, we do screen, for sugar and pressure as well. So you come in and you say, okay, you would like your sugar and your pressure checks to be done, and we will attend it to you. There is no set fee. If you want to give a contribution, it's always welcomed, but there is no set fee to it. Okay, but the call, I'm going to go back to our first caller when he said, an unhealthy nation leads to an unproductive nation. And it's this is a small saying, but it's so profound, and it speaks volume in a sense that if we as a people and the bodies in charge who have the means and resources to do that's broad screening that you spoke about, and us as individuals taking control of our health, then that in itself will prevent so many people from being diagnosed with diabetes and other conditions that can be prevented with lifestyle changes and education.
Absolutely. So part of it is education. That's part of it. But the other part has to be policy. We have to, build our environment in such a way that making healthy lifestyle choices is easy. And so in terms of exercising, so when we do we build buildings and we do infrastructure, we must do, and we do roadways, we must do it in such a way that we ensure that there's a safe sidewalk where people can walk. Do we create spaces, whether it's parks or walking trails, where people can walk safely for physical activity? When we if we look at schools, for example, you will see that many times there are a lot of little shops around the schools. The question is, what do those shops sell? Likely those shops sell what the students eat or drink or consume. And so that says a lot in terms of, what it is we're consuming in terms of our lifestyle. Also, as a country, as a people, when are we a country, folks, who are physically active, where it's effortless? Back in the day, I speak like I'm so old. you know, but in prior years, people walked a lot more than they do now, because vehicles are so much more. They are more affordable now. There's a tendency to do more driving, and so we have to be aware of that. And we have to make a better effort to walk. Because before, people would use the shortcut and they would walk up to the hospital. Folks would actually consider it an insult if you offered them a ride to the hospital.
Wow.
But now that's not the case. Most people take a bus if they go into the hospital from Roseau. And so there's a change. I thought, most people would bring lunch. They would carry lunch from their home to work, and that would be lunch. But now, if you can't afford to buy lunch, if you don't buy lunch, then you're considered cheap. Let's say it. Let's say it. If you, so then the way that we are thinking has changed, and it's in favor of developing these chronic health conditions.
Right. Okay, I think good morning.
Oh, okay.
Okay. All right. So yes, Dr. Jolie. I mean, it's all about policies and changing our mindset to certain trends. And I mean, with the schools, I know certain schools have put certain policies in place where So only fruit juices that they bring in. I think they also look through lunch bags to a certain extent, and so you have a certain control as to what the parents, send the children off to school with, and that this limits the sugar
Content,
intake and
yes.
content. So I mean, kudos, to schools who do that.
Yes, but enough has not been done. There's still a long way to go because there are still schools that the only beverage that they sell are sugar sweetened beverages,
Yeah.
with
And
sodas
carbonated, right?
and other carbonated drinks, and those drinks are being sold to primary school children. And
Mhm.
the thing is that if the kids don't have the education yet to make those decisions as far as what they drink, then they might make poor decisions. But
Yes.
yet we're offering and we're making those sugar sweetened beverages and the foods which are unhealthy available. And so so we have to rethink. The school principals need to rethink what is being sold within the school grounds. And maybe Trudy, you can say like a little bit about that because you
Yeah.
are.
I mean, what an important thing that you said, Dr. Jolly, that exists though, is not just the exact school environment, but the surrounding environment of the school and what is sold and what is available. So I know, like as you mentioned, what is being sold in the shops surrounding the schools. As a primary school student, I remember even back then. I mean, I will use the back then phrase that you were using earlier. But yeah, the only things that were available in direct proximity to the primary school were ice pops that were being sold, all the time. And then you had your little vendors with your coconut cheese and your, your sweet, your sugary snacks. And then you had a sweetie shop, or I cannot remember the name, but all students used to go there after school and buy sweets. So, that environment also needs to be looked at as
I
well.
agree.
We have a
Okay, so
caller.
yes, we'll have a caller. Okay, good morning, caller. Good morning.
Hello.
Hi, good morning. You are live.
Okay. Good morning. I in order to call, I had to stop listening, so I don't know at what point I am interrupting. But I would like, if at some point in your program you can talk about the treatment, the maintenance, and I mean, for example, I have my friend who, I mean, all her life she's walked and she's walked and she's walked, and now she's in England and they removed 5 toes. So I'd like to know, is the thing reversible as well? Thank you.
Okay, thank you very
Thank you,
much.
caller.
Oh yes, I
It's a
mean,
very important question.
of course. I mean, it is part of the discussion as well.
Mhm.
But yes, truly, as you were saying, that the environmental factors have to be, looked into as well. So we are going to continue, but before we go into the treatment and management of diabetes, Dr. Jolly, I mean, you talk about pre-diabetes and full-fledged diabetes, but what are the numbers
Mm.
that we are to look at when we test our sugar? We say, okay, those numbers are a bit too high, or my sugar levels are within the normal range. So for someone who is thinking of purchasing their own sugar monitor kit, or has one at home, or even when they go to the hospital or their private doctors and they take their their blood sugar
Sugar.
levels, what is a normal range and what would be considered as pre-diabetic range and diabetic range?
So normal blood sugar is, I used to always say, about 100. Anywhere between the 100 to 125, we call it pre-diabetes. And so 2 blood sugars more than 126 is diagnostic of diabetes. So if you check the blood sugar 2 times and it is more than 126, more or equal to, then it is diabetes. If you want to confirm, you could do a hemoglobin A1C. A hemoglobin A1C normal is less than 5.8%, 5.8%, 5.7%. 5.7 to 6.4 is considered pre-diabetes. So you're on your way, you're walking towards diabetes, and more than 6.5 is diabetes. And so those are tests that can be used to diagnose or to confirm. If you go to the doctor and they check your blood sugar just randomly, whether or not you've eaten or not, and it's 200 or more, then you have diabetes. There's no ifs, ands, or buts. So you have diabetes. So it's based on checking your blood sugar, whether it's fasting or whether it's after a meal, within 1 to 2 hours of a meal. That's how the diagnosis is made. I typically use the A1C because it does not require fasting. It gives you a better idea in terms of the category, in terms of whether pre-diabetes or diabetes, and it gives me an idea also in terms of what is needed to treat it to bring it back down to normal. So.
Dr. Jolly, you mentioned if somebody, you test the blood glucose, it's 200, they're diabetic. I know there's a particular phrase that I hear from a lot of people. Oh, I have a touch of diabetes, a trace. I did this check, and it's just a touch of diabetes.
Yes.
I have. I want to know, your your view on that. When people say that, what are they saying? And
so whenever we get bad news, the first thing we do is that we deny it. So that person is in denial, and sometimes how long you stay in denial might vary. You could be in denial for one day, or you could be in denial for the rest of your life. There is no such thing as a touch or a trace or a little diabetes. There is only diabetes or on your way to develop diabetes. That's only two categories. Either you have diabetes and the rest of us are going to develop it. So really and truly, we should all just pretend like we have diabetes. Because in terms of we all need to have our DPP, not a director of public prosecutions, but rather our individual diabetes prevention plan. Because really and truly, a diabetic diet is not there's no such thing as a diabetic diet. There is only a healthy diet. There's only a healthy diet. So people saying that there's a trace and a touch or a little, or the sugar was high.
Just at one point.
No. It's either you need to make the distinction, and you need to be very clear about it. And for the if people who come to see me in my office, I make it very clear to them, and I tell them, go home and say this to yourself: I have diabetes. I have diabetes. Because only when you accept it, when you come to the acceptance, which is part of the process, there's a process, denial, bargaining, and all of that. But when you come to acceptance, then you can do something about it. And so coming to that acceptance that you have diabetes is important. Now, if you don't have diabetes, then great. You don't have diabetes. But it doesn't mean that you can just go out there and just eat whatever you want and live whatever lifestyle. You still have to eat healthy and exercise. These things are all good for everybody. And so it's the person has not reached to the level of acceptance, but there is no trace, there is no touch of diabetes. There's only diabetes.
But just quickly before we go into the management and treatment of diabetes, you made a statement, and I'm sure many people listening would say, but how is that possible? You said that you are on your way, so everyone is on their way to acquiring. So is it like a guarantee, an automatic reality that everyone will acquire diabetes?
Well, it's not a guarantee, but this is how I want. This is how I think of it. We live in a world where, again, making healthy choices is a difficult choice. We are constantly marketed to and told that these ultra-processed foods and drinks and beverages are somewhat good for us. We also are people who like convenience as well, and so we are aware that there are a lot of people out there who have diabetes who are not aware. We also aware that the complications of diabetes don't start when the diagnosis is made. The complications actually start long before, even in the pre-diabetic stage. We also know that the major killers in this world is actually not infectious causes. It's actually poor eating habits, wrong foods. That's the leading cause in the world today. It is inadequate intake of fruits and vegetables. Imagine that. It's not infection, it's not COVID. It is inadequate intake of fruits and vegetables. It's the food that we eat. And so it's not to say that it's a guarantee, but it's something to we in terms of the education that somebody who has diabetes get. It makes no sense that we only educate the people who have diabetes. We need to educate those who do not have diabetes. If not, soon enough they will be in our office with diabetes. And so that's the point. It's not to say that you are guaranteed to develop it, but unfortunately in the world and in the environment and the food environment in which we live is one that will push us more and more towards obesity, cardiovascular disease, and diabetes.
Okay, thank you for that clarity. And so at this point, we will go into treatment and management. Someone has come into your office, Dr. Lisa Jolly. You've done the A1C test. You've done a test right there in your office as well. And it has been confirmed
that they have diabetes.
What is the next step?
So the first thing is that I have to say that you have diabetes, and I tell them, go home and say, you have diabetes. Come into that acceptance. That is the first point. Because if I write a prescription, I say, oh, take these tablets to get your sugar down because you have a touch of diabetes, the person might not necessarily be as interested or targeted. And so that's where the theme of the World Diabetes Day in terms of educate for tomorrow is so important, because diabetes requires a lot of education. It requires education about the condition. It requires education about the diet and the lifestyle changes that need to be made. You need education about the lifestyle changes and whatnot, even to prevent the condition in the first place. It also requires education about the management and how to take the medication, regardless of whether it is tablets or insulin. It also requires education about the complications too. So there's a lot that folks who have diabetes, they really need to know. And actually, one of the you can consider him the father of diabetes in himself, said that really the more you educate the patient, the better off they do. And so knowing and understanding this condition is very important. So back to in terms of the diagnosis have been made. So depending on where the A1C is, the one of the first things I go through is in terms of, I always do ask them about what they eat, and then I provide some basic nutrition information. And it has been shown that any diet is better than no diet at all. And it's not to say that somebody should always be on a diet, but it's the idea that we should always restrict to a certain extent certain foods. One of the pictures that I show them is that of the healthy plate. And once again, it's the healthy plate, because there's no such thing as a diabetic diet. And I try not to tell people what to eat and what not to eat, but rather give them ideas and clues as to what are probably the better options they are. And then that way they can create their lifestyle and their diet around what they like to eat. So one of the things that is really important and encouraging is adequate intake of fruits and vegetables. So half of the plate has to have vegetables. Half, not a quarter, not a sprinkle. The vegetables are not garnished. Half of the plate has to be vegetables. And I tell them, look here, you could have whichever vegetable you like. If you want to put half of the plate as cucumber or as spinach or whatever, go ahead. But one of the things I try to, even when I go out, I make sure I choose 2 different types of vegetables. I choose one fresh and I choose one that's steamed, because I want half of the plate to be vegetables, non-starchy vegetables. And you could have it fresh, you could have it steamed if you want, whatever way you like. I try to stay away from salad dressings because they have too much salt and they have too much sugar. Then you have to think about your starch intake, because that is the one that raises the blood sugar, because the starch gets converted into sugar in our body. And it is better, as our nutritionist said, it's better to consume more complex carbohydrates. What do you mean when we say complex? You have simple carbohydrates and you have complex carbohydrates. So the white sugar and the white rice is more simple. So they're broken down by your body quickly, and so they raise the blood sugar quite quickly. And so you want to go with more complex starches that your body has to work on, things that are higher in fiber. So that's where things like your breadfruit and maybe some fig, your ground provisions come in. And it's okay. I usually advise either the ground provisions or the rice. It's okay to have rice, but then you have a a spoonful or a decent portion, a quarter of the plate of rice. Not half of the plate rice and half of the plate meat. And then the vegetables like a sprinkle, a garnish on top, just to make the plate look pretty. The vegetables are the main part of the meal. That's the part that has the nutrients, nutrition.
Dr. Jolie, I want some clarity on this.
Yes,
For the listeners, particularly, you
yes,
mentioned non-starchy vegetables.
that's
I,
correct.
I want some examples of what are starchy vegetables because I know these are the ones that might be the nicer ones that people would,
Yes,
put themselves towards when you tell them, eat a lot of vegetables, the nice
yes.
ones. So
So
so give me some examples of those starchy ones, the starchy
non-starchy.
ones that we maybe should, not
You can
or,
have
or
the starchy you can have the starchy vegetables, but the ones we advise in terms of non-starchy. So things like the non-starchy vegetables would be like your cucumber, your
mhm,
lettuce, your tomato, your spinach. Those are the
mhm,
non-starchy vegetables.
mhm,
Starchy vegetables would be like your corn,
mhm.
sweet potatoes, beets, butternut squash. That would be your
Pumpkin?
starchy vegetables. Well, the butternut squash, not the but I
Okay,
think pumpkin, yes.
okay,
So those are some carrots would be like the starchy vegetables. So those are the some of the starchy vegetables. But the
yes.
non-starchy vegetables would be your green stuff like your
Green
egg,
leafy ones.
eggplant,
Okay.
tomatoes, celery, all of this. They are
Lettuce,
your
spinach, cucumbers, those.
yes,
Okay.
non-starchy vegetables. If you want to have the starchy vegetables, then you could put them on the other side of the plate where you have your starch. If you want to
Okay.
use it, you could put your that's another level of note. You could put your
The
like
starchy
your
veg.
butternut squash as your starch. Some people consider like one time and this and but knowing the food groups is important. We talk about it effortlessly. However, but there are some people who believe plantain is a vegetable. It's not. So I
It's
so I
also
have
high in sugar.
yeah, but I call it a starchy vegetable. So put it in the
Mhm,
corner of the starch.
mhm, mhm.
So yes.
I just wanted to bring it up because I mean, so many times people would advise, I've gotten this advice myself, eat corn and,
Mhm, mhm,
as not including the green leafy ones that you spoke about, but
mhm,
when speaking about vegetables,
mhm.
advocating for, those that you just mentioned, the corn, and even plantain too. Some people
Yeah.
will say, eat that. That's that, like, load up your plate with that.
Wow.
So I just wanted to get the correct information out there.
Oh, thank you. Yes, yes. So
Mhm.
the non-starchy vegetables, the green leafy vegetables, that's what. So nutrition education is very important. I also do a lot of other education in terms of so we educate for complications as well. I ask the patients, well, have they need to see a ophthalmologist at least once a year to have their dilated eye examinations because part of part of the diabetes, the treatment or the comprehensive care of diabetes is also preventing the diabetes complications. So we have to ensure that they see the eye doctor to look at the back of their eyes to evaluate for diabetic retinopathy, which is the complication of diabetes in the eye. You also got to have diabetic macular edema as well, and all of those things could lead to vision impairment. And so those things need to be checked out for, and if not, there is available treatment, and so we could prevent them from getting to the point where they're blind. I always look at their feet, tell them, did you look at your feet? Do you have 2 feet and 10 toes today? You have to look in between the toes, and I give them the guidance. I always look at their shoes. Are they wearing slippers or sandals, or are they wearing properly covered shoes? And I make a little critique about the shoes as well. And so that's important. I always say, so I give them some general advice, and I'm going to just expand on it here. But the feet should be checked every day. You must look at your feet, look underneath your feet. They must look to see whether there is any cuts, any redness, any swelling, any sores, blisters, corns, calluses, or if there's any changes. If you cannot see the foot, you can put a mirror on the floor and
Yeah.
look at it that way, or you could ask a family member to look at the foot The other thing is when they come into the office too, you as a doctor need to look at the feet, because sometimes they're looking at the feet and sometimes they don't have a family member to look at the feet. So
Yeah.
you have to look at the feet. The feet should be washed every day in warm, not hot water. And after, it should be completely dry, particularly in between the toes. Because if there's moisture left between the toes, then you could have fungal infections developing in between the toes that lead to infections and
Right.
amputations.
Mhm.
People with diabetes should never walk barefoot, not in the house, not outside of the house. In the house, they should wear slippers, and outside, they should wear closed up shoes. And the shoes should fit well, and they should always check inside of the shoes, because sometimes you have little rocks and stuff that get in there that can cause problems. But we understand we have a caller.
Yes. Good morning, caller.
Oh, okay. So we will continue with the food care education. Toenails should be trimmed straight across. Avoid cutting corns and calluses. Protect the feet from hot and cold. If you do not have any sensation in their feet, that's part of our assessment. Then you have to check the bath water with either using your hand or the elbow to determine the temperature. If you smoke, you should stop smoking, because if you smoke, then you could end up losing your foot. And so ensuring that you have proper footwear is important, not footwear that is going to cause or worsen corns or calluses, but also footwear that is protective of the feet.
All right. And even besides, checking our feet and okay, so I'm going to stop there. We have the caller back on the
Caller
line.
is back. Okay.
Good morning to you, caller.
Good morning, Dr. Jolly.
Good morning.
I'm diabetic
Mhm.
and I'm losing weight and I'm on metformin.
There's a bit of a
Caller, can you lower your radio?
okay, caller. If you can hear me, we're hearing some type of feedback, so we're unable to hear you very clearly.
She needs to lower the radio and
Yeah.
just
But I
listen
didn't
to
hear.
us on the phone.
But I did hear what she said in terms that she's taking metformin and she's losing weight. And metformin does cause some weight loss. But the other thing I would encourage her to do is to check your blood sugar. If it is elevated, then you need to come and see me, because the other thing too is that sometimes the manifestation of poorly controlled diabetes, weight loss can be a symptom of poorly controlled diabetes, because they're passing out their calories in the urine. And so you might need to take a closer look at the diabetes control.
Okay, so caller, you feel free to call back, but just ensure that
Yes.
the radio, or whatever device you're using to listen to us is lowered. Okay, so please feel free to call back. But
Yeah,
Dr.
I think she may have had something else.
going
She may
on.
have had another part of her question, so hopefully she can call back.
Okay.
Okay, so Dr. Jolly, so besides the management of our
Mhm.
food, our diet, our
So
exercise, there's the medication part.
yes, there is medication. Some people can do okay with lifestyle changes alone on their own, but some people need help in terms of medication. And so that might vary in terms of, it could be tablets, it could be insulin,
Mhm.
and it could be, and that could vary throughout the course of the treatment with diabetes. But whatever it is, we want to make sure that it's effective. It should keep the blood sugars down and could keep it in check. I will talk briefly about. I'll start with just in terms of the tablets. All the diabetes medications, they require education.
Yes.
We need to provide that, because the thing is that, for example, metformin is well known to cause some upset stomach and sometimes can cause some diarrhea initially.
Yes.
Some people, they never get over it. Some people, they have it initially and then it gets better with time. So saying that is important. Saying that, hey, you might experience some diarrhea initially, and it's gonna, hopefully it will get better with time.
Consistent use.
Yes, usually metformin is better tolerated if you take it after a meal as well, and so that is important in relation. A lot of diabetes medications are given in relation to food, and so the timing of the medication is important. Same thing with insulin. Insulin requires a lot of education as well in terms of where do you administer it, at what time, in relation to which meal do you administer it. And so all of those little details are very important. There are some, I wouldn't say they're not new medications, but there are new medications that are available here locally.
Yes.
That are they're combination medications, so you get two medications at the same time. So it helps to simplify the medication regimen to the point where you're taking one tablet a day or one tablet twice a day instead of having to take two tablets 3 times a day. It gets very confusing, when one tablet, you got to take two tablets 3 times a day. The other one, you got to take two twice a day. Then you have blood pressure tablets. Because the other thing is that diabetes is a multi-morbidity condition. It tends to come with diabetes and high blood pressure. You have so many things to manage apart from that. And then you still have to live and you still have to watch your food. But we have a caller.
Okay, good morning, caller. Good morning, caller. You are live.
Good morning. Good morning.
Hi.
I called a while ago.
Yes, but we still.
I would
you're
like to know
still,
where
caller.
Dr.
Just
Jolly. What?
we're still hearing a
I would like to know
feedback.
where is your office.
Okay.
Okay.
Okay. So she has the other question. Okay. So yes, my name is Dr. Jolly. I am the diabetes specialist. My office is located. My name of my office is called Bon Santé. It's located at 22 Hillsborough Street, right across from the junior house of the Wesley High School. If you want to call to make an appointment, your blood sugar is over 200, is over 300. You ain't too sure what's going on. The number to call is 449-8821. Once again, I am located at 22 Hillsborough Street in the city of Roseau, opposite the junior house of the Wesley High School. And if you want to call, you have problems with your diabetes, you know someone who has problems with their diabetes, you ask them to call 449-8821.
There you have it. But go ahead.
Yes.
Dr. Jolly, I wanted, as we were on the route of the treatment and management of diabetes, and you spoke about the oral medications, and you were just speaking about some medications that are now combination that assist with adherence. I wanted to know, if you are diagnosed diabetic and you're on a particular medication regimen, how often do you need to check in with your physician to ensure that you are still under control and think the medication is working and that type of thing? What is your frequency of consultations supposed
Every
to be?
3 months. Every 3 months. Once you're doing well and you're stable for some time, then we could spread it out to every 6 months. But if you're in the midst of changing the regimen or getting sorted out, then it's every 3 months.
Okay.
Yes.
Okay, so the purpose of the combination medications, you stated briefly for increased compliance and adherence. And this is very important because the blood sugar medications are given to help your body regulate your blood sugar levels. It is not an excuse to consume sugar, foods high in sugar and drinks high in sugar because you're on those medications. No, that's a misconception. It's like you're being treated for high blood pressure, but yet you're still taking foods high in salt content because you think, okay, I'm on the medication and so that'll help to bring down whatever salty meal I am having. So that's a myth, it's a misconception. It just means that you're making your body work even harder and you're defeating the purpose of the medication.
Yeah, so of note, there is no diabetes medication that can keep up with a poor diet.
Exactly.
There is none. We have medications that can do pretty well to help you, but at least these here are pretty expensive. But yes, even though you're taking medication for your diabetes, doesn't mean that you get to not adhere to the diet and lifestyle changes. And when I speak to folks about diet, it's not that, oh, you got to do this all the time. People have birthdays, people do go out, they do socialize. We do expect that you will have a piece of cake here or there, but then you have to be careful and note that this is not something that you do every day. And there are also ways around in terms of because we want you to enjoy your food, because part of the enjoyment of life is not being nourished but rather eaten. So we want it to taste good, we want you to eat the food. One of the things people like, if you struggle with chocolate, for example, a lot of people buy the milk chocolate bars and stuff like that they have a lot of sugar. But perhaps if you use the dark chocolate, which tends to have less sugar, that might be a substitute. So there are ways that we can work with you to ensure that you can enjoy some of the things that you usually enjoy, but at the same time you're sticking to the diet.
Justin, for your mention of basically not expecting medication to outrun poor choices. It sounded like a real pharmacist cry. I could tell. I could tell it's something that you probably deal with quite frequently. As a pharmacist, there's another thing that I know happens, and I wanted Dr. Jolly's feedback about this. People who know, and as I asked about how frequently do you check up on your condition, people who know that they are probably approaching. I know, for instance, some patients, pregnant patients who have gestational diabetes, for instance, and they have to do a blood sugar profile, and would try to fool the test by eating a certain way, just for that test day or just in advance of the test, and then, resorting to, eating in a bad way once the test has passed. So I wanted, just a comment from you, Dr. Jolly, on this thing of let's try to look good for testing. Yes, let's try to look good for the doctor. Let's try to look good for when we get our checkup. But other than that, we're going to do what we want to do.
I would say that for in terms of pregnant women, they tend to be more compliant, because really and truly they're not just doing it for themselves, they're doing it for their baby. And there are a lot of both complications that can happen with the baby and the mother as a result of poorly controlled diabetes in pregnancy. One, you could have a large baby, which means increasing your chance of having both trauma injury or having a C-section if you have a large baby. But poorly controlled diabetes in pregnancy increases the chances that child will be diabetic as well in the long run. And so it's important to explain the reason why we make a big deal of diabetes in pregnancy, but also the implications for that child as well. The child, sometimes the babies, when they come out of if they're from a diabetic mother, they might have low blood sugar, so they have issues in terms of regulating their own blood sugars as well. So it's not a good thing. But the other thing about it, you mentioned they only do it for a season, but there's ways around that in medicine. We have testing, we do the A1C, and usually that gives us a better picture of what has been going on over the past month. So it's not just for that testing day. So, it does require some bit of honesty on the patient's part, but also knowledge and being aware that, we're not just doing the test for it to look good for us. We really want the best outcome for them and for the baby. Yeah.
Wonderful. And then even after delivery of the baby, it's important that they have their regular checkups.
You do have to have regular follow-ups. They should be checked for diabetes 6 months after the delivery and every 3 years, because if you have diabetes in pregnancy, then you're more likely to develop diabetes after the pregnancy as well. And so implementing, I say, it's one thing you give birth to this kid now, then you need to be around to take care of them. And I've seen instances where their mothers were taking care of children with amputation or blindness. That's not a great situation. So they have to be really motivated to take care of themselves, really, even after delivery of the baby.
Okay.
Yes.
So our time is running down quite quickly this morning. But I see we have a caller, so this will be our last caller on the program. Good morning to you, caller. Oh, okay,
Lost that
like we
caller.
lost that caller.
So I just wanted to reiterate again on this World Diabetes Day. I hope the time flies by so quickly. We don't have enough time to do all the education we'd like to. But I hope that our listeners were able to take away something from our conversation, our visit. One, to be aware of the condition of diabetes, to be aware of the symptoms. So if you are suspicious or you have a family history, to get tested, to get evaluated, to ensure to determine exactly where you are. Do you have diabetes? Do you have pre-diabetes? And if you have diabetes, to get the necessary education to be able to take care of the condition, because it tends to be it's a lifelong condition, and you really need to be able to take care of it in terms of making lifestyle adjustments, in terms of the medication as well, to get some education regarding the medication that you're taking. So if you experience any side effects, then you are a little bit more aware of what is going on. But also to be educated about the potential complications of diabetes, in terms of the eye and the kidney complications. And so uh, this is the reason why we treat diabetes, not so much just because we like nice numbers in terms we like the blood sugar between 100 to 180. No, it's because those numbers do so much more damage than just those three numbers. And since we're just past the Creole season, I thought, if there is a way that I could let Dominicans know, for those who are English speaking, for those who are Creole speaking, I'm going to try my best to reach out to you. So you need to ochipe pisadu. Si ou pa ochipe pisadu, ou pasa vwe kle. Ou pasa pise bien. Ou pasa marche. Et puis, pour ces noms la bagay la peke bandi.
Oh, okay.
I did.
Very good.
I definitely got the last part.
Yes, c'est bon.
Oui.
Okay.
I definitely got the last part, Dr. Jolly.
So great job. Dr. Lisa, it's always a pleasure having you with us,
Thank you for
educating
having
us
me.
on so many different platforms, not just on diabetes. And I'm hoping that our listening audience also learned something. They took something away, if not just for themselves, but for someone who they know is suffering with diabetes. It is not a death sentence. However, acceptance is a very big part of management of this condition. Your lifestyle and diet is also very important. And, just continuously educating yourself, being compliant to the regimen given to you by your doctor, your pharmacist, and, just being open, to the treatment and what exactly the condition is. Trudy, any closing?
Yes, yeah, and I would just add, Jacinta, in addition to everything that you said, also the support that is so necessary that you receive, from your, whoever you live with, or your family or your loved ones, whatever, because sometimes these lifestyle changes or sticking to particular healthy lifestyle decisions can be so impacted by the people who surround you. So just, if people who you know and love or your family members are diabetic or are pre-diabetic and are trying to, change their lifestyle, just to be supportive of those decisions. You have a lot of don't worry about that, man. We'll drink and this and that and don't worry about that. So I just think the support, the kind of community and family support is also so necessary when we discuss chronic conditions like diabetes. So I just wanted to encourage also the listening public that, if you have somebody who is going through a diabetes diagnosis or going through the disease, that you are supportive of the healthy lifestyle that they need to practice.
Of course.
Yes.
Well said. Thank you very much for that addition. Okay, so this is the end of our health vibes for today. Wishing everyone a blessed week. And please join us again next week, Wednesday. Carlton
Yes.
Lando, we look forward to having you back in studio.
Mhm.
So enjoy the rest of the week and God bless everyone.
Education, information, and a bit of humor, and not forgetting lots of vibes. Hosted by Carlton Lango with Megan Defoe and Trudy Kristen. Jolly's Pharmacy is bringing health and vibes together every Wednesday, so be sure to tune in. Health Vibes every Wednesday on Q95 from 10 a.m. to 11:30.
Yes, I just wanted to tell you, Dr. Jolly, I think she's still in front of you. Yes, before I came on the show, I was just, let me leave the online